an interventional cardiologist who I did multiple fellowships in peripheral vascular disease. So actually one of the first people to be trained in PAD as a fellowship. Our primary objective and our primary daily goal is to prevent amputation and promote quality of life for patients. So we try to put people back into their daily active life, whether it's work, home activities, etc. I used to wear a lead two-piece, and that was heavy. Then my partner, Dr. Sab, and I both bought two new leads, which supposed to take the weight off your back and put it on your waist. It was a little bit better. And then we found StemRad, and I thought, this is really what we need. And I gotta tell you, when you wear it for a few weeks, and then somehow if you're a different center or a place that is not present, and you wear regular lead, you feel like something is different, something is wrong. And you do feel the difference right away. And you feel uncomfortable. When you understand and you see the numbers and differential in exposure and radiation, you really feel uncomfortable to do the cases. And the data is that we collected in our own site just for wearing it for a week is enough for me to say it's unethical for us to continue to do what we do without wearing it. And what I like about StemRad is they're offering a solution that we should have had 50 years ago. Initially, I was thinking that it's going to be in the way. I won't be able to do what I do. And the most positive surprise is how easy I can move and maneuver around. It wasn't in my way. At the end of the day, I felt zero aching or zero pain or shoulder tensions or stuff that you would get after doing 5 cases a day, right? So that was really the aha moment for me. Well, maybe 50-50. The aha moment was a radiation reduction. That was like unbelievable. I mean, I could not believe the numbers. If someone tells me this is why I will not discuss the numbers, because if someone tells me those numbers, that the difference in radiation exposure, especially scattered radiation, if someone tells me the difference between StemRad MD versus none, I would say, no, that's impossible. Okay, so I would not actually share that. I would let physicians try for themselves, because unless they do that, they're not gonna have this aha moment I did. What I learned through the StemRad MD trial that I can help my colleagues or tell other physicians is you need to step into the unknown, willing to learn what is on the horizon and what is best for you and your patients and your team. We need to take care of ourselves as physicians. And I am not being paid to say this by any means for anyone that is listening. I am not an owner in StemRad or shareholder, and I will not be, because I really want to promote this device for the well-being of our physicians, my colleagues all over the country and the world. The number of scattered radiation and radiation exposure in general to your brain, to your eyes, to your thyroids is unbelievable. I mean, the delta is so big that it's difficult for me to tell you, because it would sound unreal. So what I learned, that there is something out there that is there to protect us from having an unknown future, such as you know, squaric DNA distortion, the basic physics of radiation, as Dr. Compton described it initially when he described scattered radiation at Washington University. I mean, scattered radiation is a real deal. I mean, that can cause long-term irreversible effect in our DNA distortion. So knowing that, my advice, give this a try. Think of the well-being of your family and yourself and your patients and your team, and what you're gonna gain out of this in the future. And no pain and aches at the end of the day. I mean, what the heck? It's 2 in 1. No radiation, no pain.